Hi, fellow classmates and new professor. My name is Carmen Price. As far as field experiences go, I have some experience with children elementary school age. That's where I did my undergraduate internship with a family trauma counselor. And I really enjoyed that. I got to work sometimes with the families, but mostly it was working directly with children, elementary school ages. So that's kindergarten through, I believe it was sixth grade. And the majority of the children I worked with were either in kindergarten or third grade. Um, and it was children that had either behavioral difficulties or some form of emotional turmoil going on in their life, such as crisis within the family, a parent being incarcerated, those kind of things. I also did some kind of small psychoeducational groups with them that would help teach about bullying and handling stress appropriately, teaching them how to voice, to put words to their emotions, things like that. And most recently, my field work has been in a prison setting. My first year field work, I worked with both the Youth Criminal Offender Program, which is youth males from the age of 16 and 17, so they haven't yet turned 18. They're not mixed in with the prison population, but they've committed crimes that are serious enough for them to be in the adult prison setting. And the groups that I held with them were usually either anger management, um, handling stress appropriately, learning how to voice their emotions, um, and we used usually dialectical behavior therapy or cognitive behavioral therapy techniques to work with them. So I found that really interesting, just the difference between the elementary school age and the older adolescents. And I've also worked with some of the adult population within the prison. Um, it's all males at the prison I currently work at, so they're only men that I deal with. And I've done both individual and some group sessions so far. As far as furthering my practice, what I'd like to really focus on, what I see as an opportunity is that they do use evidence based practices, and we discuss a lot of the theories that are behind the practices we use. So I think I look forward to getting a lot of experience both learning what theories are informing the practice that I'm using, and how that manifests itself or plays out in the client situation. And one thing I do see as a challenge is, well, I guess there's two things. One is the use of self, because it is a prison setting. There's a certain interaction that you have to maintain. So, whereas if I worked outside of a prison, I may be able to show more empathy toward a client. I feel like in the prison setting, that's almost discouraged a little bit. So I've found it quite difficult, being a naturally empathetic person, to find a balance between those two, to still convey to the client that I care about their situation, and that I do want to help them learn how to work through it, while at the same time um, kind of maintaining that the professional boundary that the Department of Corrections requires that we maintain. And another challenge that I find is, um, yes, we do use evidence-based practice based on theory, but they are not as open to using um, different evidence-based practices. Usually, if a program is written in to only go by a certain therapy, say one program specifically uses cognitive behavioral therapy, it tends to be a little rigid as far as interweaving other techniques or theories into that, where a lot of the classes that we've taken, and I personally like the kind of multi theory or multimodal approach, where you can kind of pull from different theories and use whatever is best suited to help the client at the stage that they're presently in. Um, so I look forward to facing that challenge, and hopefully opening some of their eyes too, that just because it may not have as much research backing it, if it if it could be effective with the client or could be beneficial to the client, hopefully having that dialogue that maybe they'd be willing to try it out, and see if it helps. It doesn't hurt to try. Um, that's it. And I really look forward to working with all of you and getting to know you better. Nice to meet you.